and then I'm over here at YouTube. So I'm gonna be going back and forth talking to y'all. But today I wanted to talk about how nursing is changing. The career field is changing for nursing, it's changing for medicine, like, period. So I wanted to come on here and talk. I have a lot of people that always they'll email me and tell me how they're afraid of change, and so I was like, bump this, I need to come on here and talk about this for a minute. So y'all know I posted being back on here. I know I posted came on here about telehealth jobs, which I haven't been finding a lot of telehealth jobs. I don't know. I've been finding a lot of telehealth jobs for mental health. So like for psychiatrists, for nurse practitioners, for physicians, for primary care. Yeah, the same thing. For PCP. I'm talking about a lot of jobs, but I haven't been finding a lot of telehealth jobs for nurses. So I was supposed to do a video actually talking about telehealth per se, like actually what is telehealth, how you can get a telehealth job. But I'll do that. I'm supposed to be doing a question and answer, a Q&A. So if you have any questions dedicated to telehealth, leave them in this you can leave them over here, or you can leave them in the comments. Leave them in the comments below and let me know. Also, I was supposed to be doing a video on HEDIS. So a lot of people been wanting to know about HEDIS. I'm going to do a separate video. I have a lot of videos I want to do on HEDIS. One on the different requirements for a HEDIS nurse. Do you need training? If you want to do the training because you want it to look good on your resume, where you could go get the training, how much it'll be, all that stuff. So I'm going to have that information in a separate video for HEDIS. But if you have any questions for HEDIS, just to let me know, and I'll do a video about it. And that's for my LB Career Coaching page over here, as well as my YouTube. So I wanted to talk about the changes in nursing. Unfortunately, y'all know I keep it real. Let me tell you something real quick. Like, I'm a businesswoman, this is my business page, but I keep things really real, and I'm going to tell you like it is. If you follow me on YouTube, or if you know me personally or follow me on YouTube, y'all know I'm going to keep stuff real. I'm not going to sit up here and I'm not going to sugarcoat nothing, because I'm going to just tell you like it is. And I'm seeing a lot of deceiving, in the medical field, which it has been going on. We all know that, unfortunately. Hi, make sure you leave a like. Hey girl, hey. Make sure you leave a like. But anyway, we know that in the medical field, like, unfortunately, it's like a dog eat dog world. And now we coming in to save people lives, to take care of the sick and the needy, but the nurses be getting treated like crap. You hear me? We be getting treated like crap. So at the end of the day, nursing is changing. It is not the same. If you're a part of my LPNs only group, I actually asked that question because I have a lot. Thank you for the light. I have a lot of seasoned nurses. And then I started thinking, well, am I a seasoned nurse? Because I've been a nurse for 10 years, but it don't feel like it. So I don't know. But nursing, when I got my nursing license, it has changed from 2011 to 2022. Nursing has changed. But before I got out of the bedside, because when I did bedside last year, it wasn't bad. Like, I had the sweetest people. I worked for an awesome agency, and I was independent, so I didn't have a lot of micromanagement. But when I did bedside care prior to like my home health job, which I have, if you look at me on YouTube, you'll know kind of about my history. If you knew, maybe not, you have to go back and look at all my other videos, especially my videos from like 2019. I was going through a lot of stuff, and I share, with everybody and stuff like that. But like, nursing, like, people are rude as hell. Like, they're just rude. They don't have no respect for the nurses. And now in 2022, after this pandemic, and after all the nurses have done, and all the lives they've saved, and all the stress, emotional drainage that has been put on nursing, because the nursing ain't easy. That's why it's a shortage in nursing. If nursing was easy, then it'll be a lot of nurses, right? But people are going into nursing because they feel like they can make a lot of money, but they're not going into it for the passion. It takes a true passion to go into it. So anyway, I just been seeing how a lot of these people are being burnt, not people, but nurses are being burnt out, underpaid, and they're not, and underappreciated, right? So I said I need to do a video about how nursing, if you're a nurse, you already know that nursing is changing for that. And when I did the questionnaire in my LPNs only group, I had a few seasoned nurses say that, they talked about from your appearance, which I just believe in going to work looking presentable. That's just how I am. when I was in CNA school in high school, like my CNA instructors didn't play that. Like they was like, hey, you're gonna show up and you're not gonna be wrinkled. Are you gonna show up and you're gonna be dressed appropriately. You're not gonna have all this loud nail polish and nails and stuff. They were very old school, right? But now it's totally different. So she spoke on that aspect. She also spoke on just how things are now with micromanagement and how we are not respected. Like, before nurses are really respected, and they're not, and we're the one taking care of loved ones. We have to deal with so much. We bring home a lot of stuff. You heavy, you deal with a lot. So if you're tired of that, it's about time for you to make a change. And that is why I came on here, because I don't even know how, like some of my clients who have been in nursing for 20, 30 years, I don't know how they did it, how they last this long doing bedside care. Bedside care will tear your body down. And I hurt my back last year. And because you get used to lifting heavy patients and stuff, and it doesn't bother you. Like when I did hospice and I had to after they passed and went on to glory, and you have to do the after cleaning and stuff like that, and it's like dead weight. It would be nothing for me. Mind y'all, I was pregnant with the twins when I was doing hospice, and I'm talking about big, and it wouldn't be nothing. I would be used to it, right? But like that's a lot of strain on the body. And last year I did that and I hurt my back, and so I haven't been back to the bedside since then, because I could be washing the dishes for 10 minutes and my back will be hurting bad. Like, it's just ridiculous. I had to go see a chiropractor. So I don't do bedside nursing. And it's like, it weighs on the body. Like, you on your feet and you ripping and running and you taking care of people. And it's just a lot. And I don't know how these nurses are lasting. And you don't have to stay in a place, even if your body isn't tired and you don't feel like you're like, what I'm trying to say, like you don't feel like your body is wore out and stuff. Still, like, you don't have to stay in a place you're not happy or appreciated, or they're taking advantage of you or making you work all these hours and not letting you have time off. That's ridiculous. You can be at home and you can do behind the scenes nursing, which I think is bomb. If you don't know, I did HEDIS, medical case reviewer, where medical case reviewer and abstracting charts. Like, we abstract charts all the time. You look in the chart and you find information and you give it to the doctor. You look in the chart and you put it in another database, in another EMR system, electronic medical record system. Like, you do that. You've been doing that all your nursing career. Even as a CNA, as an MA, you've been doing it. Mind you, CNA and MAs can also work in HEDIS. They have HEDIS clerks. They even have MAs that specifically work with HEDIS. So you can do that too. If you know anybody that's a CNA or MA, let them know that, okay? But it's no reason for us to be like weighed down and just so heavy. And I had someone email me and they was just so scared. And I'm gonna tell you something about me. I do not like change, y'all. I am very, like, I'm a control freak. Ever since I had the twins, I had to learn how to stop wanting to control everything. And like everything that's even happening in my life right now, a lot of things are out of my freaking control. And I just been trying to stay and encourage and reading my Bible and praying a lot. But a lot of things, y'all, are out of my control. I can't control anything. I have to literally like put it on God and make sure he can handle it. Not make sure, but allow him to handle it, right? And so I had to learn how to not want to control the situation, and I had to learn how to realize that God can handle my battles and he's going to be here. And I had to learn how to let go. Like, it could be the simplest things, and I'm like, no, I want to do it my way. I don't want to do it another way. And it's like, girl, chill. Like, you'll be okay. Like, change is good. If that was the case, we'll be in winter all 12 months, right? Like, the seasons changing. We're going into spring, everything is blooming. Everything was dead and now everything is blooming into something beautiful. And so that's how our life is. Like, we have to learn how to be open to change. And I've been seeing that word a lot, like change, pivoting, even if it's not your career, if it's just something personal in your life, learning how to change. Yeah. Okay. So like, I feel like if it's something weighing on you, if it's something personal, if it's your career and you want something better, you may not necessarily want to just get out of nursing, because I've dealt with that where I was kind of tired of nursing, but we can do so many things in nursing. Maybe you tired of the bedside, so you could go into home health where you have one patient, or you could go into home visits where you go house to house, 30 minutes to an hour, visiting the patient, making sure that teaching them about their medication, teaching them about whatever is going on with them, if they have wound care, changing their wounds, whatever they need help with in a home. For that little bit of time, you could do that. I mean, you can work in an office as a nurse. It's so much that we can do where we don't have to weigh our bodies down. Even if you're not even in the healthcare field, it's so much that you can do where you don't have, where you don't have to stay where you are unhappy. It's no reason for us to stay unhappy in our life. It's no reason for us to be miserable. Now you may be in a place in your life you may can't control it. That's okay. But I feel like if it's your career, boo, you don't have to stay in your career and be unhappy. You could definitely change. And so I wanted to just come on here and talk about that, because the nursing is changing, and it's hard. It's so hard, and it's not easy. We slaved in nursing school, y'all. Like we went through a freaking lot in nursing school. I know I cried a lot in nursing school. If you don't know, I failed RN school after being in RN school for a freaking year from the ATI, which then I love the ATI because it helped me pass my boards. I passed my boards on the first try, once I went back to LPN school. But it's like it's not easy, and it's no reason. I don't care if you're LPN or RN, if you're a nurse practitioner, I don't care if you're a PA or doctor. Like, it's no reason for you to stay in your career and you're not happy, whatever your career is. If you was meant not to be working, sometimes I wonder why things happened the way they did when my job laid me off in 2020. And then I remember stressing about other things in my life. And I was like, if I didn't have this, I could do that. And so now I'm able to do that. And so God has a way. He just has a wonderful way of answering our prayers, and he's very comical in that way. And he like, hey, remember when you talked to me and you were stressed about this situation? Here you go, right here. And so, like, I just want y'all to know, you don't have to stay and be unhappy in your life. Let me read this. Unfortunately, I haven't found work from home jobs yet. Still looking. Going on 3 months. You haven't found work. Have you emailed me? Because are you a RN or LPN? Because I'm gonna tell you something. Go back to my last video. Did you look at my last video where I had somebody say that they hadn't found work from home jobs? Um or have any work from home jobs haven't called you back? Have you been applying? Like, which one? Because my last video, I talked about how you can work from home being a remote tutor for Pearson, which is a company where you do testing through. And so Pearson is actually hiring tutors for nursing. So you can be a tutor. You could tutor other nursing students, as well as if you're a teacher. So if y'all know teachers, send them my way, because I know a lot of teachers are freaking stressed out. I don't even know how they can be teachers. I just, I used to be an instructor, but that was for grown-ups, and sometimes it was like being an instructor for kids, but I don't know how they do it. So anyway, if you tired and you're a teacher, I know a teacher that's tired and wore out, they even have jobs through Pearson where they can work from home. I'm supposed to get a video on that. I guess I need to do a video on that and put it up on my YouTube channel and on here. But and put the links. Could I put the links in? But email me at lbcareercoaching at yahoo at gmail.com. I'm sorry, lbcareercoaching at gmail.com. But I do that as well. So a lot of people have, I don't know, I always been easy with finding jobs since I was like 18 years old. It's always been easy for me to find jobs and help other people and find job fairs and help people with their resume. This is something y'all, I didn't just start doing this. Like, I literally been doing this since I was like 18. And then in 2019, when I was going through issues trying to find jobs, because it was hard as a nurse, trying to find jobs. And I had three schools I was trying to get my kids to in the morning and get to work. That's impossible. Nursing hours are like 7 to 7 or 6:45 to 7:15, 7:30. When I was in hospice, sometimes I was working 14, 15-hour shifts depending on what's going on with my patient. If they died, I had to stay there and wait for the funeral home to release the body. If the family isn't ready for you to release the body, and they still there, I couldn't leave my patient. They still was my patient. So I used to be there for a long time. I had to change that job because I had the twins. It was like a lot. I had to like bounce around. I've done a lot of jobs because of the kids. And so I started helping my YouTube subscribers. I was like pouring out my frustration through them. And then it was like, well, can you help me? And I honestly was just helping them. I love helping them. And then that's how I turned this into LB Career Coaching when I got laid off. So this is something I just always done. But I find jobs so easy. That's why I'm looking over here. I had decided to make sure it was I can't find a lot of telehealth jobs, like I was saying at the beginning of the video, but there are a lot of freaking jobs, man, for work from home, especially if you have a compact license. Because now some places are saying, you can work for us out of state, but you have to have a compact license. It just depends. Oh yeah, okay. I thought so. So yeah, keep searching. It is hard. I did help you with your resume. I just couldn't remember. My mind sometimes. But yes, just keep just keep looking and email me, because what I do for my clients, I need to work better on my follow-ups. But what I do for my clients, if you tell me that, just shoot me an email and let me know that. And if I come across something, I'll send you the jobs. Like, that's just something I love to do. That's just what I like to do. Hey, Lana. But, because it don't make no sense for us to be out here struggling trying to find a job. Because at the end of the day, we got to eat and pay these bills. and also at the end of the day, we have to live. So just email me, okay? And let me know what you looking for and stuff like that. But yeah, so that's basically what I wanted to come on here and talk about. Like, you don't have to be afraid of change. Change is good. Sometimes we have to do what's best for us, what's best for our mental health. And I don't know, I'm just all big on mental health. I've been through, we have all been through so much with stress. And I feel like if it's not for our mental health, like, we'll crash and we'll go down and we'll stay down. And we have to do what's best for ourselves. So if you're afraid to change, you can email me. Just take the leap. We could take the leap together. I'm afraid to change too. I was wanting to go back into home visits, but y'all, I done been into some nasty. I'm just keeping it real. At home health, you go into people's homes. So I'm not picking on nobody, but home health is very nice. It is like, I love it because it's just you and your client. It's just you and your patient. It's bomb. Like, my last home, I didn't have these issues. My last home health patient was freaking bomb. It was just a wonderful case, and it's like, but I have been into some home health places, y'all, and doing some home visits. And home visits, if I go into somewhere like that, I stand up and do everything, my assessment, everything, vitals, and my teaching, making sure they medications feel, and I stand up and I don't put nothing down. But I have been in places where I had to stay for 12 hours in some very not, I mean, unstable home places. And listen, I be having some PTSD from that, but I want to go back into it, but I'm scared. But guess what? I'm gonna do it, because it's like, why sit here and be afraid? Like, I'm letting my fears stop me from something I want to do, where I may not even run into that. You know what I'm saying? So, and you could tell the agency too, like, if the home is like that. I just don't believe in going into a home and I'm supposed to be there for 12 hours and leave. I don't, that's just me. That's just my integrity. So that's what I did way in the past, like way years ago, way before, the twins and stuff. I did that, but I'm not gonna do that now. I can't deal with that now. But I just be letting different fears, like, think about the what else. We always think about the what else, and then the what else is what keep us from even, like, stepping into our greatness and stepping into our purpose, because we always thinking about, well, what if this happened? And who said that was gonna happen? You letting all the doubt and the fear and the negativity get in our head, and then we walk around here, and then you take the leap and you do it, and you're like, dang, I done wasted all this time thinking about the what else. And then it's just a waste of time. So y'all, we can't be doing that. We can't do that. We have to stay faithful, and we have to stay prayed up and trust God. At the end of the day, I always talk about trusting God, Proverbs 3:5-6, and putting all our faith in Him, because that's who gonna carry us and bring us through in our career. So if you need my help with anything, you're afraid to take the leap, are you ready for a change, just email me at LB Career Coaching. If you're over here on on Instagram, you can always click the link in the bio, and it'll take you straight to my website. And over here on YouTube, y'all know y'all can email me. You can also email me at momnursefashionista@yahoo.com. And that's momnursefashionista@yahoo.com. And this isn't my shirt. I love this shirt. This is not my brand, Nurse Hustle. It's like so bomb. It's one of my nurse friends from Instagram and YouTube. So I'll leave her link below if y'all interested. And if y'all interested in me, like, say y'all got a cute brand or something, and y'all want me to wear it, y'all let me know, because y'all know I love me some fashion, child. Y'all know. So let me know, and I definitely, I'll rock it for you, because I love it. But anyway, so yeah, y'all, I hope y'all having an awesome day. I'm gonna get ready to go. It's been, oh Lord, it's been almost 20 minutes. So so let me go, because I gotta run these churn around and stuff. It's spring break and all that good stuff. But like I said in all my videos, no matter your adversities that's going on in your life, always look going through them. And even sometimes we have to fake the funk, because I be looking raggedy. I just come on here looking like put together, but I be looking raggedy and feeling raggedy, and I be having to get myself out of the funk, because the kids, I can't let issues that's going on prevent them from living their life in their best life. So I have to give what I can for them and do all I can for them. So think about those. Even if you don't have kids, think about yourself. You have to go on for you, because God have you here for a reason. If He didn't want you here, you wouldn't be here. You're here for a reason. all that pain that you pushed through, you're still here for a reason. God brought you through all of that for a reason. So keep going and keep pushing, y'all. I love y'all so much, and y'all have an awesome day or night if you're watching the replay. Okay, bye, toodles.